Usually, when a man in the family is struggling with addiction or mental health, the family responds very quickly. They ask around, they find a center, and they try to get him admitted. But when it is a woman, the conversation becomes completely different. People hesitate to talk about it. Sometimes they don't even acknowledge it, and many times the woman herself will not say anything. Not because she is feeling fine, but because for most of her life she has been taught that her role is to take care of everyone else, her husband, her children, her parents, and her family. Somewhere along the way, she forgets that she is also allowed to need care. And even when a family wants to help her, there is another fear. Will this place be safe for her? Will her privacy be protected? Will she be treated without judgment? That is the problem we wanted to solve with Abhasa's Women's Center. This is not just a place for treating addiction or mental health concerns. It's a place where a woman can finally say, I am not okay, and still feel safe, respected, and heard.
Why women need a different space? In India, if a woman is struggling with alcohol dependence, depression, anxiety, eating disorder, trauma, or any other mental health concern, the first question which arises is, where does she go? Because most of the rehabilitation centers were not originally designed with women in mind. The environment is usually designed around men. The routines are designed around men. In many places, the staffs is also mostly men. Now imagine a woman who's already carrying so much of shame, fear and hesitation about what she is going through. For her, walking into the kind of space can feel extremely frightening, and because of that, many women simply don't seek help. A lot of women I meet here have been suffering silently for years before they reach us. Sometimes 5 years, sometimes 10 years, not because help was not available, but because the help that was available did not feel safe enough for them. At Abhasa Women's Center, the entire team is women. Our psychiatrists, psychologists, nurses, counselor and support team are all women. We treat addiction, depression, anxiety, bipolar disorder, OCD, eating disorder, trauma and many other concerns. We also use QEEG brain mapping to understand the person better and create individualized treatment plans. Along with the clinical psychiatry and therapy, we also bring in yoga, meditation and mindfulness. But before any of this can truly help, one thing has to happen first. She has to feel safe enough to speak, and that is what this center gives her.
People often ask me why we had to build a separate center just for women. And my answer is very simple. A woman cannot heal in a place where she feels she has to protect herself. She may attend therapy, she may sit in every session, she may say all the right things, but if some part of her is still on guard, she will not be able to open up completely. And if she cannot open up, even the best treatment will only reach the surface. Healing needs safety, not just physical safety, emotional safety, privacy, dignity, the feeling that nobody is judging her and the feeling that she does not have to hide here. That is why an exclusive women's center matters.
Most women who come here have not done anything for themselves in a very long time. Their whole life has been taking care of their family, their children, their home and everyone else's needs. So when we ask them, what do you enjoy doing? Many of them don't have an answer immediately because nobody has asked them that in years. Sometimes even they have not asked themselves that. So we don't push them. We start slowly. A morning walk, sitting quietly in the garden, joining a group activity, trying a simple art session, doing yoga, having tea with the other women. And slowly their inner child begins to come back. One woman realizes she loves painting. Another says yoga helped her feel calm after many months. Someone else sits with the group and realizes, I am not the only one going through this. That is when recovery starts becoming real. Of course, medication, diagnosis and therapy matters. But recovery also begins in a very human moment. The moment she remembers that she is a person too. not only someone's wife, daughter, or someone's mother. She is a person with her own pain, needs, and life.
We built this center in Coimbatore because we truly believe women in India deserve a space that is made for them, not adjusted for them, not modified for them, made for them. From the rooms, to the routines, to the treatment approach, to the team around them, every part of this center was created keeping women's safety, privacy, and dignity in mind.